Okay, so welcome everyone. Thank you so much for joining us today. This is another one of Wellspring's Be Well talks, and so today's talk is titled The Healing Narrative, Telling Your Story. And so I'm very excited to introduce our speaker for today, Dr. Claire Edmonds. Claire is a registered psychotherapist and holds a doctorate in psychology from York University. She has worked exclusively in oncology for 40 years with both patients and caregivers. She now works in the community, predominantly at Wellspring Cancer Support Centers across Canada, as well as other nonprofit cancer organizations. She develops programs, trains professionals and volunteers, and leads the Healing Journey program. She is an avid writer with a keen interest in medical narratives and has taken courses at the University of Toronto's medical narrative program. So, Claire, I'm so excited to have you on board with us today. You are such a wonderful leader, so close to the Wellspring family, and I'm so excited to see what you have in store for us today.
Oh, Vanessa, it's delightful to be here today, and I'm so excited to be able to talk to something that has meant a lot in my life. It's been important to me, and I'm so excited that other people are finding it an interesting discussion. So thank you so much for having me. I'm
You're
very
very
pleased to
welcome.
be here. Hello, everybody. I can't see you, but I trust that you're out there, and welcome. And I'm glad that the idea of a medical narrative is something that you find interesting and I hope inspiring. So this presentation is actually following another wonderful Be Well topic of a few weeks ago, actually September 25th, by Paula Holmes Rodman. She's talking about presenting the idea of what medical narratives are, and I think Vanessa will be putting a link in the chat to guide you to that if you're so interested. She gives a very cogent and relatable description of how narrative medicine has developed through history, what it is, and how it is a valuable tool for facilitating understanding between patients and medical professionals, fostering empathy in the medical relationship. Today, I'll give you a brief description of what narrative medicine is, just to situate our discussion. But I'm going to be taking a different tact than the previous Be Well talk. I shall present to you examples of different forms of narrative medicine that I have actually practiced myself. And I'll be discussing how narrative medicine has helped me heal in my own cancer story. So what is medical narrative? We all have narratives. We all create narratives about our lives, stories about our lives, and how our experiences and our understandings of the events in our life within the context of the bigger story. A narrative isn't a news report, nor a listing of events that have happened. Rather, it is how it felt, how we have come to understand it. Medical narratives are quite a specific form. They often focus on the diagnosis and the treatment of an illness. I think of it as a threshold that we cross from being a well person to being a patient. Crossing that threshold brings us into a frightening and disorienting world where the focus is on our bodies and the mind and spirit are catapulted into a struggle to understand who we are in this new world. In a medical narrative, we can use imagery that helps us to capture the mood or the impact of an event, such as, it was like being hit by a tsunami. That's a metaphor. It wasn't a real tsunami, but it felt like one. In the medical narrative, we can toy with the causes why we believe that this illness has occurred, even if there's no way of actually knowing it, knowing the sequence of events that have brought us to this moment. In a narrative, there's no right, there's no wrong. It carries the authority of your own experience, your feelings, your perspective. And I think that, in fact, is what gives it so much power. The power to help ourselves heal, and perhaps the power to express to others the impact that this experience has had on us. Perhaps in time, creating our narrative helps us find meaning in our experiences, can help us reclaim who we are after being changed by this event, changed physically, emotionally, socially, spiritually. Narrative can take many different forms. It can be written as a story or poetry. It can be drawn, painted, collaged, photographed, any medium that speaks to you. It contains facts, but it also has feelings, impressions, and the images of the event through your own eyes. For me as a therapist and as a cancer patient, I have learned that the narrative process allows us to string the pearls of experience, to place it in order, to organize it in our minds and our spirits so that we can rest more easily with it. It gives us a beginning, it gives us a middle, and it can give us an end, and the opportunity to add more chapters. I like to think of narratives as kind of an ongoing story about who we are and how we live our lives. I think another really powerful aspect of creating narratives is that it fosters self-compassion. We can hear our own voices. We can validate our own feelings. We can linger over the parts of the story that have been diminished or glossed over by others. Maybe even more importantly, diminished or glossed over by ourselves. So in this session, I will describe the narrative process and share several of my own narratives of my cancer experiences. And we're also going to try it together as a group with a simple writing exercise. And our goals are to acknowledge the traumas that the cancer diagnosis and treatment bring for the patient and the caregiver. I do hope there are some caregivers in our group today. And to explore this technique as a potential channel for healing. So I come to this moment both as a psychotherapist with many years of experience listening to the stories of people coping with cancer. But I also come to this moment as a cancer patient myself. The experience of being diagnosed and treated for cancer is long and hard. And it is often a confusion of feelings as we try to absorb what is happening to us, what it means, and how we'll cope. And cancer isn't just one experience, it's a whole bunch of experiences. Many, many experiences. It is the experience of the diagnosis that can come after experiencing symptoms for a long time and undergoing testing, when the diagnosis may actually come as an almost relief or an explanation for what is happening. And for others, the diagnosis comes out of the blue as a shock, maybe through testing that is scheduled and expected, routine testing, or maybe through a sudden presentation of symptoms. From the initial news, the testing, surgery, surgeries, treatments, more testing, more treatments, and side effects. The term side effects has always amused me, really, as I have experienced them more as central in my life effects, where I have learned to have to live around them rather than being able to shove them to the side. So I think side effects is kind of an amusing term. It just does not describe my narrative of experiencing them. So how do we make sense of the tsunami of feelings and experiences? How do we master this part of our story? How do we integrate these events so that we are part of the process, not just somebody to whom all these things are happening to? We can become a part of it and understand it rather than being passive. So let me first describe the first piece I'd like to share with you today. This is the context of my experience. I was first diagnosed with breast cancer in May 2015. It was a beautiful spring day, and it was my birthday. And this experience is indelibly imprinted on my memory, as I am sure your diagnosis is indelibly imprinted on you. Now, the following 2 years were a tangle of treatments and side effects, and what is called a complex recovery with twists and turns that I could never have predicted. And it all happened against a backdrop of many, many years of working with cancer patients. I do remember thinking I'd studied cancer for over 30 years at that point. I knew a lot about it, but I never wanted to learn what it was like on the other side of the curtain, the examining room curtain. And here I was about to have my education really deepened in a way that you can't learn unless you're in it. The very night that I was diagnosed, I started journaling. And when I couldn't sleep and the rest of the house was quiet, I turned to paper and pen and I just wrote. It was a place where I could say the things I was most scared of the things that I didn't want to say to those around me. Journaling was like the comfort of a friend who would take in everything that I had to say with no judgment, no brushing it away, none of those false assurances that friends so often give us in order to make us feel better, or maybe to make them feel better, I'm not sure. I carried my journal with me everywhere. I wrote in waiting rooms, in exam rooms, coffee shops, my garden, my office. My journal was a patient and willing companion. And as a side, I remember a very odd interaction. I was waiting for a doctor's appointment in the waiting room with a lot of people. And a gentleman was sitting beside me and I'm writing away. And he leaned over and he said, "What are you writing?" Like, "I'm writing in my journal." And he said, "Well, what are you writing about?" And I said, "Well, I'm writing about how I feel about being here." "Oh," he said. I think he really wanted me to talk more about it, but I said, "And it's very private." At which point he pulled back. But it was one of those odd moments where I was happy to let people know what I was doing, but I wasn't ready to share it. Sometimes when I was journaling, I discovered that words weren't quite enough to capture what it was I was feeling. And so I began to work with metaphors and images, kind of drawing pictures with words. I didn't write for other people. It was private. I told my family what I was doing, that it was raw feeling, unprocessed, perhaps unpleasant. And that if they wanted to know what was on my mind. They needed just only to ask me. They didn't need to look at my journal. I have likened this process of journaling as composting, taking raw material and putting it to rest, and to see perhaps if anything will grow from it. It's not supposed to be pretty. It's not supposed to be elegant or eloquent. It's just raw. When the intense period of cancer treatment and recovery was resolving, I began to feel a need to make sense of it all, to understand what had happened to me, in what order. The events were a tumble in my head, a jumble of tests and appointments and information and surgeries and treatments. It was just disorganized. I began to feel the need to make sense of it and what happened, in what order, to tame the memories and own them, rather than to have those memories pounce at me unexpectedly out of the blue in my dreams or even in panic attacks. I used my journal to reconstruct my experience, to place in order this jumble of moments that had piled up inside my head. It was kind of like unraveling a traffic jam and parking all the vehicles neatly in a parking lot. And it allowed me to place this breast cancer experience into the context of my life, to integrate it into the larger story of my life. And so what I'm going to share with you are a few excerpts of that written work, not from the journal, but from the material that I worked with from the journal. It's all quite personal, and you may or may not relate to it, and that's okay. Reading other people's narratives gives us a chance to see things differently, perhaps through another person's eyes, or to have some insight into another facet of our own experience. Now, we're talking about stuff that's pretty triggering, because after all, we're talking about something that we all share, and it's going to bring back memories, I'm sure. And if you do feel triggered, I want you to take some deep breaths and be compassionate towards yourself, and to take care of yourself as you need to. So I did use some photographs just to illustrate some of the things that I'm writing about, mainly to give you something to look at as I read. So I'm going to ask Vanessa to give us the first slide. There we are. What would it be like to look down the path of your life like a falcon, coursing through a blue sky, skimming along the edge of the thermals? You would be able to discern the twists and turns that you took through your life and see how it all related. Moments that you might have thought of as random would now have meaning. Decisions that you thought you made were not actually decisions at all, but a natural evolution of your path. Perhaps you would be able to identify the themes that appear and reappear in your life. See how twists of fate were in some ways predictable consequences of your earlier life. Next slide, please. You might be able to see the terrain and its grades and valleys that forced you to take one route rather than another. You might even be able to say or to see where you took the hard route instead of the easier path. Maybe events in your life would come together into some sort of integrated whole. And if you were brave enough, you might even look into your future. For me, I am beginning to understand how I arrived here at this point in my life. What had felt like fate was perhaps driven by my desire to resolve the past in the present, a hope to confer healing for my future. And perhaps I have always known that my future would be shaped by breast cancer. It has been a motif in my own life since I was an infant, when my father's mother died of breast cancer, and 12 years later, when my mother's mother died of it, and a few years after that, when my mother had to make a very difficult decision because of the threat this disease poses. Next slide, please. When do the currents and eddies that guide us to our callings reveal themselves? Thank you. Thank you, Vanessa. So this is sort of an introduction to my narrative. It places me, in retrospect, looking at the whole experience, looking down on it. And I think that that's what narrative work offers us, is an opportunity to see the terrain, the path we've taken, the things that have happened, and how perhaps it has informed us to be the people that we are in this moment. So that is one form of narrative, and it was taken from my journals, and it's kind of an introduction to the bigger narrative that I wrote. I also worked in with other techniques. I became interested in poetry. I've always loved poetry and the power of words to evoke images and pictures. And so I wrote a poem about the diagnosis, the moment, the day. And the thing that informed it was a repetitive thought in my head. So this is how it happens. This is how it happens to me. And so I needed to write a lot about this as a way of organizing it in my mind. And I think perhaps to master it and diffuse it, perhaps like disarming a bomb that I had to learn how to live with. So I wrote in my journal that raw compost that captures the shock and the horror and the panic and the doomsday thoughts that we are all tormented by, particularly initially. So I started off writing prose, and then I began to experiment with poetry. And so I wrote this poetry based on that repetitive thought that I had through those first difficult days. So this is how it happens to me. So, Vanessa, would you please bring up a slide for us? Next slide, please. So, this is how it happens. Like a small bird struck by a stone, it falls piteously, tumbling. No chance to release its wings and right itself, to catch the horizon and feel the lofting air beneath it, crashing, insensible and stunned, its perch long lost in vertigo and broken feathers. Next slide, please. So, this is how it happens. On a beautiful May day, with the rustle of spring in the branches and the dizzying scent from the French lilac opening its buds, full of hope and promise, until the call. The stone unfettered by an anonymous god that hits squarely in the heart. Next slide, please. And so this is how it happens, as it has happened to countless other women, the stone secreted in the breast, made known, its malevolence unearthed. I'm so sorry to have to tell you. So this is how it happens to me on a sweet May evening, my day of birth and a day of death, of peace, of mind, of body and breast. I know the mutilations, the multitude of mutilations that will follow, as it did for my mother and her mother, and the many mothers that have come before this moment. So this is how it happens. Next slide, please. The blind slinger catapults his shot, its menace, into my life, and tears apart the soft evening, and rents the certainty that the sun will rise tomorrow. This is how it is happening to me. Thank you. Not everybody likes poetry. I guess how I view it is a condensed version of the experience carried by metaphor, and the contrast for me between the beauty of a spring evening, I'm so fond of spring, and that sense of the beginning of a new year marked by one's birthday being so shaped by this phone call that changed everything. As luck would have it, my recovery from breast cancer was not the end of my cancer story. And very oddly, very strangely, 3 years after I was diagnosed with breast cancer, I was diagnosed with an extremely rare form of cancer. It's interesting because breast cancer is one of the most common, and malignant melanoma of the eye is one of the rarest. At the time, I was taking a course, in fact, at the medical narrative program at the University of Toronto, and I was with a bunch of other healthcare professionals. We were introduced to all different kinds of narratives and different styles, and we were taught to do close reading of fiction in order to build our own skills in appreciating the stories of others and to hone our ability to listen deeply, not just to the words, but to the feelings and the intentions underneath those words. So one of the forms of narrative that was presented to us was graphic work being drawings, kind of like cartoons or comics. Maybe you've seen graphic novels. They're storylines, they're pictures with stories. And I'd like you to know that I rejected it right out of hand. No way. If you can use words that are so wonderful and complex, why would you want to draw pictures? But then I got hooked. I'm no artist. I am no artist whatsoever. I have no artistic training and I have no special talent, but it caught my imagination. And I decided to give it a go because I thought it might be a new way to express this very odd experience of having altered vision and treatment for eye cancer. So the next series of journals, I did do some writing, but I also did a whole lot of drawing, which took me by surprise. Drawing of eye surgery, of radiation, and then learning to live with the aftermath. And it's rather interesting that the aftermath has been predominantly a visual impairment, and I chose to draw it, which kind of surprises me, but then, why not? I've included here just a few images to give you a sense of how it works. And if it turns you on, if this is an interesting idea to you, I used the internet to learn very basic drawing, I mean, really basic drawing skills. The skills that I needed. I was very specific. What are the proportions of a human being? What does a face actually look like? What does an eye actually look like? As I say, I'm no artist, but it became a very powerful way to capture the experiences that I had. And as an aside, I presented the whole narrative work. I'm going to just show a few slides today. The whole narrative work to a group of healthcare professionals who were learning about clinical trials. Clinical trials are very technical, a lot of statistics, a lot of graphs and curves. And during this conference, there were a lot of them working away on their cell phones, and one ear to the speaker, but another, their attention obviously divided. They've been talking about rare cancers and clinical trials for rare cancers. I was the last speaker of the day. When I did my presentation, the room went silent. All the cell phones were put down because I was reminding them that behind every statistic is a human being. And in fact, I was one of them. And that the graphic materials that I was showing them made it real for them. It made it real for them. And afterwards, I was very struck by the comments and even tears of some of the participants who had observed it, who had taken in the graphic novel. And I think, in time, that became kind of a reason to continue the journaling, or not just the journaling, but the medical narrative, in order to help people see behind the statistics. So I'm going to ask Vinitha again to give us the big screen. Remember, I am not a professional artist. These are not professional pictures at all. And there we go. So this is me. I'm running. I used to be a runner. I first noticed it when I was running. And I captured the distortions that the cancer created in my eye as an exclamation mark and stars and sort of shooting stars and electrical currents. It didn't actually quite look like that, but I knew there was something very off. And so I asked, "Hey, babe, does my right eye look weird to you?" No, it looks okay to me. Next slide, please. So I go to my doctor, I go to my GP, and she says, "Optometrist? New glasses?" No, ophthalmologist. And you can see in the drawing of my face, you can see the stars that are surrounding my eye. I knew something was really off. And so then this comes the testing. And we all know what testing can be like. Sitting in a dark room, in this case, with the large gizmo in front, and you're looking through lenses. I'm looking up, I look down, I look left, I look right. And the physician says to me, "Well, you have a well-developed cataract," which is cat dancing to the left. "But what concerns me is a dark growth on the back of your retina." An immediate image that came to my mind was one of a spider. And so the rest of the graphic work presents my concerns about the cancer as being this spider that introduces itself in almost every picture. And there it is, sitting there in this particular, before I've really absorbed the information. Next slide, please. And so I am set spinning. I'd work with patients at home. I spin and I cannot stop. This was very, it sort of captured the feeling of being in that uncertain place, of not quite knowing what it is, not quite knowing what we're going to do about it, not having a plan. And that feeling of just spinning, spinning, spinning. And in the diagrams, in the pictures, you can see the stars are still present over my right eye. I spin and I cannot stop. And there I am, I'm holding the edges of the frame to try to stop the spinning. I remember that sensation of spinning very clearly. Next slide, please. This was how it felt. And there are words within this, but I think it captures a feeling. So there within my right eye, you can see the pupil, but you can also see my friend the spider sitting in there. And I feel like I'm trapped in a web. And these are all the questions that I asked. Will I go blind? Will this kill me? Am I going to die? Take one step at a time. I wonder if it's breast cancer, if it returned. Can I do this again? You'll need to help me. Help me. I'm trapped. Those are the feelings that were really beyond words, and I think almost part of a dreamlike quality that period had of spinning and also feeling trapped, knowing there was really no way out but through. We all recognize that feeling regardless of the kind of cancer you've coped with. Next slide, please. And so I had surgery. It was very successful. I was really, really lucky. And then I had radiation. That was brachytherapy. So it's a radioactive patch on the eye. At home, I inhabit the couch. And if you look up in the right-hand corner of that room, you'll see the spider web. My family puts drops in my eye and fresh bandages. I take codeine for pain and I watch Netflix and I zone out. And I become obsessed with one-eyed women. This is first one here is a painting by Modigliani, who said actually about the women that he often painted women without pupils. "When I know your soul, I will paint your eyes," said Modigliani. Queen Nefertiti, that wonderful statue, she has only one eye. I really thought about that for a while. And then I got kind of silly and I thought about the Venus de Milo, who has no pupils, but she also has no arms. So I suppose it kind of all goes together. I got playful, right? I got silly about it. Next slide, please. And so after all of that treatment, I'm unpatched and I'm beginning to take in my new world. And this is that idea about side effects again. Are they at the side or are they central to our lives? It was fairly central for quite a while in my life. Everything was double. I had double vision. And I became very clumsy and I trip and I spill things. I can't tell what is real and what is a figment. I was a bit notorious. I've knocked over more cups of tea than I care to report. And at night, all the lights create halos and double halos. And we'll shut down this one and we'll come back to Patty in a moment. Thank you, Vinitha. So that's an odd way, perhaps, of presenting it. And you may have your own reaction of, oh, those are kind of juvenile pictures, or it may speak to some truth for you. I don't know. You can see they're not sophisticated pictures. I messed around with them a fair amount. But what it did do is capture some dreamlike quality, I think, of some dreamlike quality that this had for me. So the final piece that I'm going to show you today, I think, again, it's a graphic piece. I got kind of into graphic work for a while. As I say, no great talent at it. It wasn't about talent. I think it was because it allowed me to show people what I could see, show people what this was like in a different way. I did write a lot of poetry about it too. One of the things is that many of you are going to relate to, after having two different kind of cancers, in fact, I called that narrative work blindsided, because that's how it felt. I felt blindsided, something coming out of the blue and hitting me, which is, you know, how these things are experienced. I noticed afterwards, I lived with a lot of anxiety, and anxiety that would pop up out of the blue, inconvenient moments. The aftermath of cancer, I was deeply rattled. And I was pretty traumatized, actually, by all I had been through, both the wonderful care that I received and some of the less sensitive care. Yeah, it had imprinted itself on me. And I think that medical trauma is something that's really underappreciated in the field. I think that many of us experience it, but we don't really talk about it. There's some talk in the literature about post-traumatic growth, which kind of fits in with resilience. I could do a whole thing about resilience. Resilience is a tricky concept. I often felt like people talked about resilience just as, oh, you're so resilient, as a way of sort of moving me along. And I'm thinking, I don't feel very resilient. Yeah, there is post-traumatic growth. I think that I've experienced a lot of post-traumatic growth, but that doesn't minimize the feelings of trauma that I felt as I worked through this. So I found the best way of managing and externalizing my anxiety was to imagine that I was living with a very large tiger. And I named him Patty the Trauma Tiger. He needed a name. And at first I saw the tiger as a very scary thing to live with. He was fierce, he was kind of unmanageable, he wasn't tamed. I would take him to appointments and he'd be furious and full of feelings and fear and hissing and spitting and swiping. And that was my anxiety. Felt like I was hitting and spitting and growling, but I didn't actually literally do that. It, again, this is metaphor, it's how it felt to me. And so I found that by imagining these feelings being personified, projected into Patty the Trauma Tiger was really, really helpful, because I began to see that I was responsible to Patty to take care of him, and that Patty's behavior was really about protecting me. Problem is that he was protecting me from a threat that had passed, and he continued to behave like the threat was here. And I needed to help Patty understand that we were okay, that we were in it together. And it shifted my feelings from being intimidated and scared of these feelings to seeing them as really just the part of me that was trying to look after me, but was a little misguided and needed a lot of support. And so Patty was pretty good metaphor for me. The panic attacks and nightmares were my body's way to protect me from threats. The only problem was that, as I say, I was fighting off something that had passed, and it wasn't helpful to be in this mode. So I imagined Patty sleeping with me at night, watching over me. I imagined that we sat together in doctor's offices, and I even have an image of myself holding his tail as he sits beside me. I'm holding his tail both to comfort me and to comfort him. And I drew lots of pictures of Patty, and I used photographs from the internet of tigers to practice getting him right. I drew pictures of Patty being fierce and volatile, and I drew pictures of what helped Patty feel calm, secure, and cared for. And so we'll have a few slides here of Patty the trauma tiger. Denise, if you could find him, that would be great. We'll call him, see if he comes. There he is. So Patty watches me overnight, and there I am having a bad dream about running in the night, and Patty is sleeping beside me, and I see him as a protector. I could almost imagine feeling him breathing beside me and knowing full well, of course, it's my own breath, but feeling that sense of companionship with this part of me. Next slide, please. There I am in the waiting room. Patty's not happy. That's a picture of an unhappy tiger, but I'm holding his tail. I don't look very happy either, actually. But then whoever is happy waiting in a clinic. So I'm holding his tail, and that's comforting me, and it's comforting him. And he looks just about under control, but not quite. Actually, it's a pretty funny expression as I come to appreciate it on the screen. Good old Patty. Next slide, please. And so these are the things that I discovered really helped Patty feel calmer. In fact, made me feel calmer. When we're talking about Patty, we're really talking about me, of course. There I am swimming, and do you know tigers swim? I didn't know that, but they do. And so Patty and I would go swimming. Patty and I meditated a lot. It's me oming and Patty purring, because really a purr is very similar to an om. And that's Patty and me going for a jog in the park. And those are his little back feet sticking out. And he found that really calming, and I found that really calming. And as I say, Patty and I had lots of adventures together, and I found that a very helpful image. Thank you, Anissa. I think that's great. So those are, I mean, I suppose kind of unusual and a little different. And I hope that the idea of writing a narrative, which can feel triggering and overwhelming in some ways, can also be a form of catharsis, organization, externalization, validation, and really a way of developing, I think, a deeper sense of compassion. It certainly did that for myself, a deeper sense of compassion for me. I can be kind of tough on myself. I push myself. And when I wrote narratives, I thought, no, wait a minute, I've been through something here, something worthy of noting, something worthy of processing. So I don't know. Are you game to give it a go? Well, we're not going to go into the woods here. We're gonna start off with some rather simpler, a simpler exercise, just to warm us up to see if this is something that might appeal to you. I hope you have a paper and pen. I think the paper and pen is pretty terrific because it doesn't spell correct and it doesn't look formal. It looks messy and you can draw at the same time. And I'll tell you, my journals are messy. There's something rather nice about being messy. These are messy feelings, so we don't have to be neat. We don't have to think about this as having a right and a wrong. There is no need to judge it. I think of it really as we would listen to a dear friend. If a good friend at Wellspring said to you, I really need to talk to you about something that's happened to me, what would we do? We would sit quietly And we would validate and say, yeah, I hear you. It's tough. Get it. Yeah. And that's really what we're offering to ourselves when we journal, is not judgment and not dismissive and none of that. What we're looking for is that kind, compassionate ear that we often offer to other people far more quickly than we do to ourselves. And in journaling or in narrative, what we're doing is we're bringing that compassionate self to this moment, to my experience. No right, no wrong. It's to be shared if you like, but that's your call. You don't have to. And you may not be ready to. It may be something that comes in time. So we're going to sit for about 5 minutes just to give you a go. I hope you've all got your paper and pens available to you. And we're going to put up a screen. Could you give us the next slide then, Denise? Awesome. So we don't want them to be triggering. Here are the prompts. What is the story of your name? Now, that's kind of an odd question, but I bet you I'll have one. Everybody got named somehow, and you want to know. We often ask, where did my name come from? So you may have a story about your name. A little more triggering might be tell the story of one of your scars. Now, it doesn't have to be a major scar. It could be a scar on your knee. It could be a scar that happened as a child. It could be from when you fell over on your bicycle, or it could be when you were cooking dinner. It doesn't have to be, unless you feel ready. You choose something that might be less triggering, but it's your call. Tell the story of the last time you held someone's hand. Tell the story of a medical professional who helped you, or anything else you want to write about, anything else that you'd like to draw. Why not give it a go? So I'm going to go quiet, and we're going to go for, I'm thinking 5 minutes. I'm going to sit here quietly, and I'll bring you back in 5 minutes. It's about just about 30 seconds to go as we finish up here. Okay. So letting that go, I hope that maybe you want to continue writing. I really hope that if you can bring me back, that would be great. Anita, thank you. I hope that this is something that kind of turned you on and you'd like to take more time on it. That's a great idea. Are there any questions? Is there anything that I can help you with?
Hi, Claire. So I just wanted to get on here before we did get to questions to just say a heartfelt thank you for sharing your experience, something as personal as your own cancer journey and how you managed to sort of navigate that and what tools you used. I really, really do appreciate you being brave and being so willing and vulnerable with our community today. So thank you so much for that.